I welcome you to the September issue of ASJ, and the first paper I would recommend is in the oculoplastics section by Dr. Guy Masry and his colleagues. They discuss the much often discussed and controversial topic of post-blepharoplasty lid retraction and bring to us what they call some new insights. Their new insights are worth reading, and of course the commentary by Dr. Sonny McCord puts all of it into perspective. In the September issue, in the rhinoplasty section, I recommend the paper from Turkey by Dr. Kuran and his colleagues, The Lateral Crural Rain Flap, where they describe a technique for controlling nasal tip rotation through the flaps. In the cosmetics section, we have a level 2 study from UT Southwestern by Drs. Kinkle and his colleagues, who evaluate the effectiveness of micro-focused ultrasound system for improving skin laxity and tightening the lower face. I feel that this paper is timely. We hear so much about these non-surgical modalities for tightening the skin and improving the appearance of the lower face and neck. So it's good to have a level 2 study so that we can have some evidence-based medicine when we make these recommendations to our patients. In the breast section, I have chosen 2 papers. The first is our CME article on augmentation mastopexy by Drs. Michelle Spring and Grant Stevens. They review the various techniques for augmentation mastopexy, and I feel that this will be very useful for those who are just beginning their career in aesthetic breast surgery, but also for those of us who have several years of experience. This will be an excellent refresher. The second paper is by Dr. Tsai and her colleagues on breast striae after cosmetic augmentation. We have always seen patients who develop these changes in the breast skin following augmentation, but now with the findings of Dr. Tsai and her colleagues, at least we can warn our patients and discuss with them the predisposing factors that may lead to the striae following breast augmentation. Finally, in the research section, I highly recommend a special topic on local anesthesia toxicity by 2 anesthesiologists from the University of Chicago, Drs. Dickerson and Dr. Apfelbaum. They clearly discuss the various local anesthetics that we always use daily in our practice, the risks, how to avoid toxicity, and even more important than that, how to deal with toxicity. So I hope you'll enjoy the September issue, and as always, please write to us, make suggestions for topics that you'd be interested in hearing about. See you in November.